Welcome. My name is Nancy McKenna. I'm an associate professor here at UNC Chapel Hill in the Audiology doctoral program. I am joined today by Kayla Rankin, who is
Hi.
our student services specialist. And together we oversee most of the sort of administrative aspects of the admissions program here. So we're going to present to you sort of the main highlights of our program. Our website is a great resource. Please go to our website for more information. So let's get started here. And I'm going to share my screen just super briefly. Okay. So one thing I want to make clear is that although most of the things we talk about will be the way it is in the future, we can't be certain. We all know there have been changes due to COVID, and it's hard to predict exactly what things will be like. So the typical sequence of clinical activities, electives, et cetera, could look different, but in general, things are going to be as we describe and talk about today. So the university is a beautiful campus, and because it's in a small town, it's a very walkable campus. And I recommend that you take a look online and get a better sense of it. The university itself is fairly large, and that's really an advantage for students in a graduate program because they have peers, not just the peers in their program, but peers across the university in graduate and professional programs. And that makes it a much more interesting place to be. UNC Chapel Hill is nationally ranked in many categories across the university. Our program here in audiology is ranked, I think we're co-ranked 5th by US News and World Report, and we have been in the top 10 for many years, basically. One of the strengths of our program, I think, is that we are overseen, basically. We're in the house of the School of Medicine, and that gives us tremendous opportunities for multidisciplinary interaction, and also gives us access to a lot of clinical opportunities we might not have otherwise. So we're just down here. We're part of the Division of Speech and Hearing Sciences, along with the Master's in SLP and the PhD program in Speech and Hearing Sciences. And then within that, we're part of Allied Health Sciences and our sister disciplines, for example, physician's assistantship, physical therapy, occupational therapy. Again, we have a lot of interactions with them. And then School of Medicine, as I say, is our not our overlord, our house, basically. We're also right next to the School of Nursing. We're down the street from the School of Education. We're across the street from the School of Social Work and Pharmacy. So many, many opportunities for multidisciplinary interaction. So what sets us apart? I think one of the things that most people would say about us is that our clinical experiences are remarkable, both in terms of variety and how much clinical experience you get. Every student in this program graduates with hands-on experience in cochlear implants, in vestibular treatment and diagnosis, in pediatrics. And that is not always true for all programs. We have a true commitment to excellence in academics and in clinic. And that is driven in part by the fact that our faculty, our teaching faculty, have a variety of degrees, but many of our faculty have just AUDs. They don't have PhDs. And almost all of our faculty are clinicians as well as professors. So we have a strong connection to our profession. We know what's happening in our profession. We deal with professional issues all the time. And because of that, we want to prepare you not just for current practice, but for future practice. And I think that's huge. You don't want to be prepared to get the job that was out there last year or 10 years ago, you want to be prepared for the job that's going to be out there for you 10 years from now. Other things that I think set us apart, we have a long history of leadership, especially in pediatrics and in developmental disabilities. However, there's a good deal of strength in adult practice as well. Our faculty clinic is mostly an adult practice clinic, and it is a model clinic and is run like a private practice. I've touched on the multidisciplinary environment, but I haven't really mentioned how collegial our faculty is, and indeed all of North Carolina, all of UNC is. We value excellence, but we don't value excellence at the expense of others. And that makes for, I think, a true sharing of goals and work and a degree of collegiality that is very enriching. This just goes over, we have 13 full and part-time faculty, and they are not all in speech and hearing sciences. Some are over in the medical school, some are at UNC's hospital system. As I said, our curriculum is comprehensive, and we have a significant emphasis on basic sciences, both coming in as prereqs and then as preparing you to take on some of the more complex areas in audiology. We emphasize reasoning and critical analysis. Audiology at one point was really a technical field, and it's really grown away from that, and it requires different skills, and our curriculum emphasizes those skills. You also get academic preparation in specialty areas ranging from cochlear implants to the business of healthcare to pharmacology, genetics, vestibular, tinnitus, all of the areas that you need to be a generalist in the future. Our program of study is about a 4-year program, 3 years, 9 months. You come in the fall of your first year, and you end in generally May of your 4th year. The credit hours, about 100 credits. It depends on the year. It depends on your program. You'll look at the next slide. You'll see how class versus clinic works. There are electives, but we really see this as a professional program, and almost all of your coursework is taken in common because you need it to be prepared. Students do have faculty advisors, and of course, COVID has affected teaching in class somewhat, but at this point, the labs in some classes are actually been taught on campus. Other classes are hybrid, others are online only, and we've been very sensitive to students' needs and aware that some students may have more concerns, and we've tried to address those as well as possible. All of our on-campus classes employ the use of personal protective equipment, distancing, cleaning, and I think that's been really a crucial element to allowing us to have some classes in person. So how much clinic, how much class? First year, you're in class a lot more than you're in clinic. Second year, it's about even. And third year, you're in class generally about a day a week, and in clinic about 3 days a week. So as class goes down, clinic goes up, basically. So your workload per week is about the same throughout that 3-year period. Fourth year, of course, is the externship year, and we'll look at that in a moment. Clinical education, it starts first semester, first year. So our students right now, they're in clinic, they're seeing patients, they're not doing virtual learning as part of their clinic at this point. They are actually in clinic. Our faculty practice clinic is where students often start their sort of clinical experience. This, as I said, is run like a private practice, and we do a lot of different kinds of things, including going on site to retirement communities, educational audiology programs and services that we contract out, hearing conservation, tinnitus, hyperacusis, vestibular services, and then the more typical diagnostic assessment, hearing aids dispensing, hearing aid support, assistive device support, oral rehabilitation. So first year students often say, you know, this is a great place to start. I want to go somewhere else, and they do. And then they come back as third years and they can really appreciate the diversity that they can get at this clinic. There are many, many UNC hospital sites that we use for clinic, and they include both ENT, adult and pediatric settings, infant hearing screening, the Carolina Institute for Developmental Disabilities is associated also with TEACH, which is an autism center. This is a very strong, there's a very strong interest in autism at this university, and a number of programs sort of all come together through Carolina Institute for Developmental Disabilities, but it's wider than just autism. Cochlear implants. The pediatric and adult programs here are among the largest in the United States, and that's one reason our students can get such great clinical experience, because there are hundreds of cochlear implants in a year at this institution. Some of the non-UNC sites that our students go to include VAs, ENT practices, school systems, audiology private practices, large hospitals like Duke Hospital, Baptist, Wake Med. So they do get a variety of experiences outside of the UNC system, which I think is really helpful. Fourth year externship, that's that last year. It's almost all clinical. There's very, very little academic part to that. And that is generally arranged by the faculty extern coordinator based on a student's sort of preference list. So students don't negotiate a contract on their own or anything like that. That's the role of the coordinator. Students do apply with the coordinator's support. So most of our sites are pretty close. A few are more distant. Wake Med, for example, is in Winston-Salem. Students request to go there typically because it's such a great site. Students don't go to all sites, but they go to at least one semester at every type of site. So everybody gets a vestibular placement, everybody gets an ENT placement, everybody gets a pediatric diagnostic setting type of placement, everybody gets a rehabilitative hearing aid type setting for peds and adults, but they may not all be at the same place. As I said, there are some virtual hours that we've made available, but we don't depend on those for clinical hours. So students do have faculty advisors, and we do have competency exams. And students sometimes look at our program and they say, oh, that sounds so scary. Actually, it is a way for us to know how well students are doing and how well we're teaching, but it also is a way for students to know how well they're doing and to build confidence in their skills. When you passed ACOMPS, when you go for your fourth year interviews or for your job interviews, you know you can do things under pressure. And I think that is a really valuable thing. So our students leave here not just knowing how to do RECD, for example, but being able to do it in the spur of the moment. All right, so we've seen this. Let me kind of move ahead here. Students have been passing the praxis, which is the exam that most states require passage of for licensure without any problem. Now, students often ask about research opportunities. There are research opportunities, although we do not have a capstone project as a requirement. Students can take independent study. They can work in existing labs. All students take this course, 950, so that they are knowledgeable about research, so they are good consumers of research. And as part of that, they do a poster. LEND, which I'll talk about very briefly at the end, the LEND traineeship positions include some research. Students also apply successfully for summer T35 grants, which are research grants that are about 3 months long at a few sites across the country. They're very competitive to get those, and our students have been very successful getting those. We do find that although we see ourselves as a clinical program, students do go into research positions, clinical research positions, when they graduate. So we have students who work in cochlear implant research positions for some of the big companies or in university settings. We have students working in research at hospitals across the country. And then we've had students go on and get PhDs as well. Oops, that's not helpful. We do have a Student Academy of Audiology. It's really quite active. I urge you to write down their handle here, and you can follow them on Twitter, on Instagram. They do lots of really fun things, social things, networking things. They participate in advocacy, and they do service projects, and those vary by year. And this year, of course, has been a little different. Some of them, the service projects have been local, some have been international even. All right, graduation. When students graduate from here, they're prepared for licensure. We focus on North Carolina, but North Carolina standards are among the highest in the country. And we certainly make sure that students who want to be licensed elsewhere have what they need. Students may also prepare for certification, and that's something to discuss with advisors. So, application and admissions.
Okay, so in regards to applications and admissions, our program uses SIDCAS for admissions, and SIDCAS is an application service that simplifies the process of applying to communication science programs. SIDCAS basically will verify your application for accuracy, calculate your GPA, and send your application to many communication science programs you wish to also use the service. The deadline to finish the application is January 18th, and you have to have a verified application in order to be sent the UNC supplemental application. So it's 2 different applications that you will have to fill out. And please keep in mind to, if you are interested in our program, to send your transcripts as soon as possible. Due to COVID-19, we have noticed that there's been a bit of delay sending and receiving transcripts. So if you are applying, you want to get those transcripts sent to us, I would say in November, early December, because you will not be verified if we don't get those transcripts on SIDCAS. And the link to this application for the UNC supplement will all get sent out on the same day. So if you finish your application early and is verified, and you don't receive that link to the UNC supplemental, do not panic. It will all get sent out on January 18th, and then you have until January 26th to finish that.
Okay.
Let's see. Also, all applications received carefully considered by the admissions committee. And after an initial review of applications in January, an invitation to interview is extended to about 25 to 30 applicants. Normally, there's an on-campus interview, and we require all individuals seeking admissions to the audiology program. However, due to COVID-19, we will be doing virtual interviews. And the interview invitations are typically sent out in mid-February, and interviews take place on 1 or 2 days, whether it's a Friday or a Monday, in late February or early March.
Okay, yeah, that's the process, and processes are a little different at different schools. So if you're in this process of applying, I really recommend, get organized, get all of your necessary things sent out for schools as early as possible. I sort of skipped over prerequisites because if you're in the application process, this is probably something you've already looked at. I think key facts are if you don't have prerequisites that we are asking for, you need to have a plan how you're going to fill in those gaps because prerequisites matter for our coursework. If you don't have enough basic science, you are not going to be very successful when you take some of our coursework. So if you do have any questions about that, you can email Kayla, and if it's a very specific question, she'll get me in on that discussion too. But do keep that in mind. So decisions will be made in early March, and you'll be notified no later than about March 15th. So students at that point who are offered acceptance or are waitlisted will be invited to apply for training grant funding. The funding process is really different from the admissions process. So when you are offered admission, that's one piece of information. Notification of funding awards usually comes a week or two later, end of March, possibly even early April. And we talk about this process in great detail when we do interviews. So I know it can be frustrating. You want to know exactly what's out there, but it is a process. So it is more appropriate to talk about it during that interview time. The deadline for you to accept or decline our offer of admission is April 15th. Generally, we look for a class of about 10 students, and I think that's what we'll be looking for in this upcoming year as well. We get asked these questions all the time, and I'm going to let you kind of read through them on your own. And if you have specific questions, you can always get in touch with us. But I think it is helpful to take a look at those and recognize that, everybody who applies may have their own particular question or their own particular concern. Generally, the application is designed to stand on its own. So, I wouldn't worry about little things. Non-traditional students, if, are students who've been out for a bit, you may have more questions than a student who's still in school or graduated recently. In that case, feel free to email me if you have questions. So financial issues. And again, I recommend you take a very close look at all the schools you apply to understand the financial issues.
In regards to financial issues, or just tuition in general, you can find more information at the cashier's office website. When you click on it, it is on page 6 at the very top. And remember that these costs are estimated and they can change. But the most important thing is our students are always enrolled in 9 or more credit hours in the fall and spring semesters for year 1, 2, and 3. So you really want to take a look at that, and North Carolina residents versus non-North Carolina residents tuition is a little bit different.
So students in their 4th year are not enrolled for as many credits, so they pay about half the tuition that students pay in other semesters. So we didn't really talk about this before, but in the past, in the summer, we haven't had any academic content in the summer, but students have gone to clinic basically full-time for half the summer. So we've had sort of summer 1 clinic and summer 2 clinic. This year, obviously, that was different, and that may change in the future. But in the past, students have just registered for 1 credit in the summer. So, Kayla, do you want to comment about the process of out-of-state students being reclassified?
Yes. When you do apply and you are an out-of-state student, and you want to reclassify, because let's just say you're just now moving to North Carolina, but you haven't been to North Carolina for a year yet. What you would do is you would fill out you would go to a link where you would fill out your information. They'd give you a classification code where you then upload information like your driver's license, your address, your tax information, just to see if you would qualify. If you don't, you would just reapply in a year or so and upload those informations again. And that link that is attached to the registrar's website will automatically adjust your position um, in the computer system. So if you're out of state, you will eventually see your tuition go to in-state tuition. But you definitely want to let us know that you're doing this and keep us up to date. Make sure that we're in the loop so we know to make sure to make that the registrar's office is updating your information so you don't have to pay that out-of-state tuition.
So at this point, I think all of the out-of-state students who've applied for in-state classification have succeeded in doing that. But we have no say over that. That's a different process from us.
Yes.
I want to touch really briefly on funding opportunities just in general. First-year students are eligible to apply for federal training grant support, as I said, and that occurs after you've been admitted or waitlisted. Now, all incoming first years are eligible for other educational stipends as long as they have a FAFSA on file. So we encourage every student to file a FAFSA. It doesn't matter what your personal circumstances are, you're a graduate student, file a FAFSA. In the past years, all incoming students have received support. But as I said, that support is not always offered at the time of admission. It may take a week or two, or even 3 weeks for that to become available. So, and we talk about that in great detail at interviews. So lastly, just to wrap up, wanted to show you pretty pictures of Chapel Hill, which is such a gorgeous campus, and talk a little bit about what it's like to live here if you don't know this area.
Yeah, for someone like me, I'm originally from Illinois, so it's cold up there, and I've lived there for 15 years. Moving to North Carolina was a really good change for me and my family. We love having seasons that aren't so tremendously cold during the wintertime, but not too hot like Florida or California. Very diverse, very welcoming, happy people who are here. And you can see that also in the programs at UNC. In particularly our program, we have students from all over the states who come here and they really enjoy it. So if you are feeling a little like, oh, I don't know if I want to come to North Carolina, trust me, guys, it is beautiful here, beautiful scenery, mountains, trees. The people are great and welcoming. We have a variety of different transportations. RDU Airport is really close to us, and we have trains and taxis and a whole bunch of different ways to get to our school, and just a lot of different places for you to visit and experience. And it's really great. As someone who's not originally a North Carolinian, I do enjoy it here.
Yeah. You know, some people like the fact that we're between the mountains and the ocean. Now, the mountains are not that high, but they're very pretty. And it is a really vibrant community, you know, in terms of the arts, in terms of sports, in terms of natural environments, and just opportunities to be involved in things in different ways. You know, although Chapel Hill is a small town, not that small, it's probably 50,000, 60,000, something like that. Durham is 10 miles away where Duke is, and that is a very lively place. And Raleigh, again, is just down the road. It's considered a big city. Research Triangle Park is a major research center. There is a lot going on in this area. And if you like to eat, there's lots of food. Food and music.
Yes.
All right. Well, thank you very much for your interest in UNC's audiology program. Hope to meet you sometime. Kayla, any last words?
Yeah, if you have any questions, definitely feel free to email me. I will provide you with as much information as I know about our program. If you're having any technical difficulties with applying, please reach out to me as soon as possible so that I can help you. And yeah, that's pretty much all I have.
All right. You can find out more on our website. You can follow SAA as we discussed. There are lots of other links on our website to learn more about our program, UNC Chapel Hill in general, and this area. Have a good day. Bye-bye.